Hey everyone, my name is Masud. Welcome back to the channel. In today's video, I'd like to talk about what are some of the other health professionals that you'll be working with as a physio. So as you know, physios are a part of an MDT team, and in that MDT team, you are working with the other health professionals. So I think it's important to understand their role and possibly just learn how it could impact what you're doing in your practice as well. So to start off with, just off the top of my head, some of the other professionals that you'll be working with are a GP slash consultant, a nurse, occupational therapist, a speech and language therapist, rehab support worker slash healthcare assistant, and perhaps even a psychologist as well. So just to add a little bit of context to how you'll be working with all of those people, I'd like to give a typical example of a ward round in the NHS. So in the NHS, when you're working as a physio, you may have a ward round every week or every other week. I don't know, each trust has its own schedule, but you'll have a ward round where all of the health professionals will meet together at a particular time and go through all of the patients and how they are progressing. So each of the different professions have their own perspective on how the patient is moving along in terms of achieving their goals. As a physiotherapist, to give you an example, your goal is really just to help the patient mobilize up to a level where they were pre-admission into hospital. So that's probably their baseline level of mobility. And that's, for example, if they came in if they were independently walking and now they have just had some sort of hip replacement and they're using, or they've had a fall, they're using a four-wheeled walker. Your job is to basically get them back up to an independent level. And you have to basically just, provide a comment or two about what they're doing, what they have done in the week. And for example, a GP or consultant will probably advise on the patient's medication and bloods alongside input from the nurse and perhaps a healthcare assistant who they also are involved in that as well. An occupational therapist may talk about, the patient's progress, about they mainly are involved in functional tasks like eating, drinking, doing things that are involved in everyday life. You may also work with them in doing things like a stair assessment of the patient. So how safe are they going up and down the stairs, and teaching them how to, maneuver their legs and use their arms up and down the stairs. You may also even do like a home assessment. So go into the patient's home with the OT and just looking at their home environment. How safe is it for them to be coming back home? So this is usually at the point where the patient is close to point of discharge, and looking at things like, the height of chairs, the stairs. Do they have stairs? Is it a bungalow? And how can they actually, safely discharge the patient from the hospital and back into their home life without any risk of any complications or accidents or anything like that. The healthcare assistants and rehab support workers, pretty much you'll be seeing them in and out of the wards or wherever you work every day. So whenever you are trying to walk with the patient, or perhaps just getting them out of bed, that's not really your job, but you may be involved with that. And usually you might be working with a healthcare assistant or rehab support worker. Their job is really just to help feed the patient, manage their care. So basically like washing them, dressing them, things like that. And so you basically be around all of these other people. The speech and language therapist and psychologist, I'll be honest, I think I didn't really work alongside them. So you may have limited exposure to these professionals depending on the setting that you're in. Usually, I think they work more in community sort of settings rather than acute, because in community, you are more likely to get people who are elderly and have more sort of comorbidities. So like neuro things where either their speech is affected or their speech or they have a cognitive impairment and they can't think for themselves or something like that. That's where the psychologist comes in. And it's basically, to summarize, it's basically everyone's job. We work together holistically to be able to successfully discharge the patient at a baseline level, so their baseline level, and so they can return home safely. That's basically the job. And this video was basically just like a little snippet of the kind of things that you'll be doing, working alongside the other professionals. You may also be involved. You may also share an office with the other health professionals. So yeah, that's pretty much it, really. Hope you gained something from this video and it was insightful. I will catch you in the next one. So don't forget to subscribe. Cheers. Thank you.